I want to start this video by saying somehow or another, I think we've lost our way in medicine in terms of what our real purpose is. And that is first to do no harm. So when you know you're going to undertake someone to surgery, make sure that they can survive the surgery. At least tell them the risk that there is a possibility of likelihood of dying with surgery. And so when you have a heart that was once normal before surgery, and then you have a heart showing extensive acute heart attack in multiple areas, and I'll show you what I'm talking about with that, then you have to, accept the blame. And I try to keep my practice completely transparent because I've done autopsies in the past where pathologists have rendered their opinion in error in defense of attorneys who try to downplay my findings. So I keep it publicly transparent. Now I'm going to go down and show you some of the key areas of ischemic. Actually, this is a heart attack. So if you look at this area here, I'm going to go down already because I don't want to take up a lot of time with the video. You can see the muscle cells are divided by acute inflammatory cells. And you see some sprinkling of extravasated red blood cells or acute hemorrhage. That is classic sine qua non of acute heart attack. And I can peruse around and you can see it more damage right in here. And I'm going to go down just to convince to you that these are neutrophilic inflammatory cells percolating through the muscle. This is dying muscle cells from acute ischemia or a heart attack. And you can see that there. You see necrotic debris along with the acute inflammatory cells. And one of the things you see with acute acute heart attack is elevation in troponin. And I mention that because a troponin level before surgery must be taken. The person must be told whether or not they could survive or not survive surgery, and so forth and so on. And this was a surgery unrelated to the heart, but rather an aggressive bypass surgery on the celiac artery and hepatic artery. And I'm going to show you another part of the heart that shows chronic ischemia. So even at this low scanning power, you can see that there is no doubt that there is long-term damage to this heart, even before the surgery. So and here's you see fibrosis intersecting the muscles. This is chronic classic example of ischemic heart disease. And so when you take someone to an aggressive surgery, the likelihood of them having a heart attack with operating on the big blood vessels in the aorta, in the abdomen, you're going to possibly run the risk of a heart attack. And I think this complicated the issue, but I think this patient also died from the procedure itself as well, from bleeding from the procedure. And there was also evidence of a heart attack, as I showed before. So let me go down just to kind of show you that, this heart was taking a damage long before, and then you wonder how a doctor, even before she needed the surgery, wasn't advising about, your heart is pretty bad, you have ischemic heart disease, it's not going to look well for you ultimately. And in ischemic heart disease, you see the fibrosis, you see some myocyte nuclei hypertrophy, and scarring fibrosis intersecting the myocyte. And it's very difficult for muscle cells to beat when the heart muscle cells to beat when they're surrounded by fibrous and scarred tissue. Thank you.